Welcome to Health Professional Radio. I'm your host, Neil Howard. In our series on DDW 2020, or Digestive Disease Week 2020, we're speaking this morning with Dr. Andrew Chan, Chief of Clinical and Translational Epidemiology Unit at Massachusetts General Hospital in Boston. And he's joining us here on the program to talk about DDW 2020 topic entitled Physical Activity is Associated with a Lower Risk of Esophageal Cancer. Welcome to Health Professional Radio, Dr. Chan.
Thank you.
Give us a brief background, a little bit of your experience, and talk about your role there at Mass General briefly.
Sure. I'm a gastroenterologist, and I've had a longstanding interest in cancer prevention. Gastroenterology is one of those fields where much of what we do clinically is really try to prevent cancer, both with the work we do with screening colonoscopy, but also increasingly we're playing a role in the prevention of esophageal cancer. And through this work, I've become interested in developing and thinking about new ways of trying to prevent these types of cancers. So we really wanted to, in particular, focus on the role of diet and lifestyle in the prevention of GI cancer, understanding that these are simple, modifiable interventions that people can take on in their daily lives to really help reduce their risk of developing some of these very deadly cancers. So through my role as a physician, but also in my training as an epidemiologist, and in someone who's done a lot of research looking at the role of diet and lifestyle in public health interventions, this work came together to look at the effect of physical activity on risk of developing esophageal cancer in large populations.
Specifically at DDW 2020, you talked about physical activity as that relates to certain types of GI cancer. Is that correct?
Yeah, and I think the background is based on, I think considerable evidence already that physical activity results in meaningful health benefits. Certainly it's well understood and most people understand that being physically active is important in terms of reducing one's risk of developing cardiovascular disease. And in recent years, I think it's become apparent that this also might translate into benefits for cancer. And in particular, it's been demonstrated in a variety of studies that people that are more physically active have a lower risk of developing particular cancers. One cancer in particular that I've been interested in has been colon cancer, because there are a lot of overlapping risk factors for heart disease and colon cancer. We do know, for example, that colon cancer is predominantly a disease or a cancer that develops in quote-unquote westernized populations. So those areas of the world that are more developed and really have more of a lifestyle akin to what we have in the U.S., which is a more westernized diet, and oftentimes a more physically inactive lifestyle. So it's been of interest to know whether that also potentially is a play for development of other cancers, which we also have seen track with a more westernized lifestyle. So as many of your listeners may know, esophageal cancer is a cancer which also is rising in incidence, and in particular is rising in incidence in parts of the world where there is a sort of more westernized lifestyle. So we wanted to understand whether trying to sort of implement interventions in this setting might actually make a difference. So we wanted to look specifically at the role of physical activity in preventing or reducing risk of esophageal cancer.
So understanding how physical activity is beneficial, cardiovascular, the muscular system, bones, respiratory. What did you find during your study that relates physical activity to cancerous cells and how cancer works?
Yeah, so it's a great question. I think, we obviously know that cancer is a complicated process. There's lots of different reasons for why people develop cancer, and sort of a lot of different sort of biological mechanisms at play, which make normal tissue and normal cells transform and become cancerous and kind of grow in an uncontrolled way. Some of those are potentially directly related to certain pathways that are known to be affected by physical activity. One example is We know, for example, that people that are overweight or less active tend to also have a high level of insulin resistance, meaning that their bodies are less able to really handle glucose, and they're also potentially more likely to develop resistance to the effects of insulin, which is to help glucose get metabolized in tissues of the body. So that insulin resistance also looks like a potential mechanism by which cancers grow, that you tend to then develop, for example, high levels of insulin circulating in the body, and those high levels of insulin in turn can encourage normal cells to grow uncontrollably and lead to cancer. So if you can develop ways to try to reduce insulin resistance, that might have an impact on cancer. So it's been shown that physical activity tends to reduce insulin resistance. It tends to also reduce potentially the levels of circulating insulin in the body. So that may be a way by which being more active and also, trying to reduce one's overweight or adiposity may actually help to reduce those pathways that encourage cells to become cancerous.
Did you find that physical activity at certain levels release certain chemicals or hormones or in the body that directly affected gut health or GI activity as it relates to cancer?
Well, in the particular study that we presented at Digestive Disease Week, we were asking the overall broader question, do people who are more physically active have a low risk of esophageal cancer? In that particular study, we didn't specifically look at the circulating inflammation markers or insulin. We have done that in other studies, in other settings, and shown those to be true. And we've also shown in other studies that people who are more physically active do tend to have differences, for example, in their gut health and their gut microbiome. So I think if we connect the dots and look at that data from those studies and relate it to the study that we presented at Digestive Disease Week, I think we can sort of draw some inferences that potentially the reasons why we do see this lower risk of esophageal cancer in people that are more active does potentially relate to the ability of physical activity to improve gut health, to maybe also improve aspects of the gut microbiome, and also to alleviate some of those inflammatory pathways and insulin-related pathways that tend to predispose people to the risk of developing cancer in the first place.
Talk about where you see research in this field going as a result of your findings in this particular study, and give us a website where our listeners can go and learn more about DDW.
Well, I think this research does really promote the fact that we need more work on preventative measures for esophageal cancer. I think that we are quite aware that it's a cancer that's rising in incidence. It's extremely lethal, and there's not a lot of preventative measures that are available for our patients. Physical activity is one such intervention, which is relatively easy to implement, and I think we should study that more intensively. Can we, for example, do clinical trials where we actually ask patients to be more active to see if it can reduce some of the biomarkers that we think link to esophageal cancer in the future? And also, can we do some more mechanistic studies to understand what's the sort of mechanism by which people who are more active have a low risk of cancer, and that can really help to lead to the development of new preventive interventions down the road.
Dr. Chan, I thank you for coming on and speaking with us about DDW 2020.
Thanks for your interest.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.